Welcome to Employee OSHA Training 2013. I am Kelly Ogle, an OSHA specialist with Doctors Management, and I will be presenting this material for you. Safety is everyone's responsibility. Even though you have some people in the practice that may have more responsibility administrative-wise than you, your compliance with safety regulations is as important as their administrative duties. We start here, looking at an OSHA poster. If you are under federal OSHA, then you should have a poster that looks like this. If you are under a state that has a state OSHA program, then you should have a state OSHA poster that looks a bit different. Every OSHA poster is going to tell you your rights, what your rights are, and what the employer's responsibilities are. The employer is required to furnish you a place of employment that is free from recognized hazards, and they must comply with OSHA regulations. This poster has a lot of useful information on what your rights are, as well as contact information if you should feel the need to contact OSHA. It should be posted so that it is accessible to every employee. OSHA is built on the General Duty Clause that says every employer shall furnish each of his employees employment and a place of employment that is free from recognized hazards and shall comply with OSHA regulations. This means it is primarily your employer's responsibility. However, there may be someone in charge of your OSHA program. Although there are some things you might want to know for your own well-being, as well as how to respond to an inspector if you should get an inspection, you need to know who is in charge of your OSHA program. There may be several different titles, but you need to know that person's name. You also need to know where your OSHA poster is kept and where your OSHA manual is kept. It may be on your server, but has to be available to you at all times and not locked up in the manager's office where you do not have access when the manager is not there. We are going to talk a lot today about bloodborne pathogen standard. This is really the standard, or the hazard, that has the most concern for you. This covers every employee whose job responsibilities put them at risk for exposure to bloodborne pathogens. We have a new standard that came out in 2001, also a new compliance directive that came out more towards the end of the year. You, as an employee, have the right to access that standard and to receive a copy at no charge of your employer's exposure control plan within 15 days of a request. Bloodborne pathogens are microorganisms that you cannot see with the naked eye. They are transmitted primarily through contact with infectious body fluids. OSHA has quite an extensive laundry list of body fluids that are considered potentially infectious. They include blood, semen, joint fluid, vaginal secretions, amniotic fluid, saliva and dental procedures, and so forth. Vitreous fluids in the eye. Also, anytime there is a mixture of fluids and you don't know what all is present. However, there are some exceptions here. Urine, vomit, and feces, which are the ones that you are most likely to come in contact with, especially in medical practices, are considered infectious under OSHA's bloodborne pathogen standard only if you can see blood in them. So if you have some urine for a urinalysis and it is yellow or clear, it is not considered potentially infectious under the standard regardless of a positive occult blood test. However, we are going to treat them as if they were infectious to protect ourselves and others. Here we have a partial list of examples that are considered bloodborne pathogens under the OSHA standard. Hepatitis B, hepatitis C, and HIV, these are the ones that we're going to be spending more time on. Creutzfeldt-Jakob disease, mad cow disease in humans, malaria, and syphilis are a few more. Hepatitis B, with the virus itself pictured here, can have symptoms such as jaundice, fatigue, anorexia, nausea, and vomiting. This virus often attacks the liver, transmitted through a splash, splatter, or spill into open wounds, mucous membranes, or a sharps injury. There are around 1 million people that are affected with hepatitis B. 500,000 die annually, and only 5% of those infected experience a chronic infection, which can lead to cirrhosis, cancer, or death. We have carriers that might never have symptoms, but can always give them to others. Hepatitis C is another virus that is kind of a cousin of hepatitis B, with the virus shown here. It causes liver damage and is the #1 cause of liver transplants. All of these viruses cause essentially the same symptoms, but the ones that can stand out for hepatitis C is extreme fatigue and abdominal pain. It is also transmitted through the same mechanisms as hepatitis B. There are about 3.5 million people with hepatitis C, with an 85% chance of getting a chronic infection, maybe asymptomatic and passing it along all the time for up to 20 years. No vaccine or immune globulin have been made, but there are some medications. However, these medications are so toxic that many people rather take their chances with the virus itself. HIV, or human immunodeficiency virus. About 1.5 million people are HIV positive. The infection rate is increasing, but the death rate is decreasing, which is really good news. It is due to the fact that there is better treatment out there. Same mechanisms of transmitting the disease as hepatitis B, hepatitis C through contact with infectious body fluids. The symptoms include swollen lymph nodes, weight loss, night sweats, opportunistic infections, and skin lesions. Once again, some people can be asymptomatic for a long period of time, but keep passing it on to others without knowing. There is no vaccine or immune globulin. There were some clinical trials for a vaccine, but there were more people getting the virus than those getting well from it. One person has actually been cured. This is not the norm. These deadly diseases, of which there are 27 recognized bloodborne pathogens, are transmitted by a splash, splatter, or spill into the eyes, nose, mouth, open sores, or other mucous membranes, and primarily through sharp injuries, which occur during injections, IVs, surgical, dental, or invasive procedures, and cleaning of contaminated items after the procedures. They are also transmitted through the general community. These occur with sharing of dirty needles or sexual contact. They may also occur between mother and child while in utero or breastfeeding. Your risk to bloodborne pathogens is based on your responsibilities. Some of these responsibilities are listed here. The first couple are taking and handling lab specimens, handling biohazardous waste and body fluids, tending to wounds including capillary or venipuncture sites, cleaning contaminated instruments on surfaces, and also aspirating fluids, surgical and dental procedures, and administrative injections or IVs. Under OSHA's bloodborne pathogen standard, we follow universal precautions, which actually predates the standard itself. This is an approach to employee infection control and teaches us that no matter how well we know someone or well respected they are in the community, we treat all blood and other potentially infectious materials as if we knew that individual had one of these diseases. We don't make exceptions, and we don't make waivers. We have to buy into the fact that these diseases are devastating. You must protect yourself and those around you by following universal precautions. Some of you may be familiar with the standard precautions that are recommended by the Center of Disease Control and the American Dental Association, but are not enforced by OSHA. Under standard precautions, all body fluids except perspiration are considered infectious, which this means to you is if you are handling the urine specimen that we are discussing earlier, your program says that you're going to follow universal precautions and you choose not to wear gloves, you would not be fined by OSHA. However, if your written program says that you will follow standard precautions and you are not wearing gloves, then you would be fined. Employees are always allowed to request more than the minimum personal protective equipment, and you would not be fined for going above and beyond. OSHA is the minimum. One of the very best ways of protecting yourself from bloodborne pathogens and other pathogens is hand washing. What you don't know and what you can't see, what the patient doesn't tell you, can make you very sick and can even kill you. It can allow you to pass those deadly diseases to others. No gloves are 100% protective. Every manufacturer will tell you that there is potential for very minute holes you may not see, but they will allow those viruses to pass through to your hands. Hand washing is imperative. Ideally, when you first come on the job, before and after gloving, and before and after every patient procedure, which should be the same. Certainly, any time your gloves were visibly soiled, your hands were visibly soiled. You have touched anything that may have been contaminated. Hand washing with soap and water for 15 to 20 seconds. Scrubbing all surfaces, not just your palms, but between your fingers, the backs of your hands, around your nails, around your jewelry, and up to your wrists. This is for your protection. It is not a surgical scrub. There are times when hand sanitizers are acceptable. That would be for general hand cleaning, when you did not come in contact with anything that might be contaminated. However, the use of hand sanitizers has to be done properly as well, and that would be using enough of the product to keep your hands moist for 30 seconds while you are rubbing the surfaces together as if you were using soap and water. Now oftentimes the hand sanitizers are more accessible, and they are effective as long as they are used properly. Make sure the product has at least 66% alcohol, which most of them are now. Nothing beats hand washing them with soap and water, though. OSHA requires the use of safer sharps, which would be those that include some kind of safety feature that is part of the device. OSHA requires every employer to evaluate, choose, and use available safety devices, to document that evaluation process, to include and document training for the safety devices. There are some early on experiences where there have been sharps injuries due to safety devices than when using conventional devices. So employers said that they were not going to use the safety devices for that reason. And OSHA said, then we will fine you for the failure of training their usage and the failure to use them. The concept here is you are experiencing injuries for safety devices that you are not using them correctly and therefore need additional training. OSHA requires employers to reevaluate every year and document sharps injuries. Employers are required to use these safety devices, not to choose a conventional device just because it is available, and report any sharps injuries as well as any bloodborne pathogens exposures when they occur and not when you start seeing symptoms. Some examples of safer sharps would be some blunted suture needles, and there have been many reports that they are more difficult to use. There is too much tugging, and that causes as much trouble for the user as it does for the patient. The needleless systems suggest the air gun injections, and I heard that if either the patient or the employee move, then an accident may occur, and this is more trouble. Needles have engineered safety devices, and they have many, but we have one pictured here for you that you just push the little device over the needle. There are self-sheathing needles where the outer barrel of the syringe goes over the needle, like the one in the picture. There are retractable devices, hinged covers, self-blunting needles. There are also safety blades and scalpels, plastic blood collection tube, and self-sealing capillary tubes. The one needle that is exempt is that needle which is used to draw up medications, provided that needle is covered, removed, discarded into the sharps container, and then the safety device is used to administer the medication. All sharps, even though if they are safety devices and are covered, they must be discarded into a sharps container. Commercially available, the sharps container should be puncture resistant, leak proof all over, color coded or labeled, kept upright, can close and be sealed for transport. Do not overfill these containers. I cannot stress this enough. In Tennessee, you fill it up 2/3 even, though this may be well before the items inside have reached the fill line. Reusable sharps must be transported in a container that meets the same criteria, except it does not have to be locked. The sharps must be placed in these containers in the room they are generated in, and then transported safely to the sterilization area. Try to avoid scrubbing by using the ultrasonic cleanser or an enzymatic soak. Then you only have to wipe or rinse. If you must scrub a contaminated item, whether it is sharp or not, scrub with the instrument and brush totally submerged in a basin of water. If you cannot avoid that and must scrub, wear mask, gown, gloves, and face protection. For scrubbing sharps, the gloves must be puncture resistant. Please understand that soaking and scrubbing in a sterilant does not sterilize them. These chemicals do not go through the biomatter that is attached to these instruments, and in fact it hardens the material and makes it more difficult to scrub. Work practices. OSHA has a hierarchy of hazard controls starting as far away from the employee's body as possible, with engineering controls which include the safety devices and the sharps containers. Working towards the body with administrative controls, work practices, and then personal protective equipment as your last line of defense. Then going to surveillance when all those controls have failed. No mouth pipetting. The man pictured here shows us what that is. It is similar to siphoning things up like you would do in a straw. It used to be done quite a bit, but is not allowed anymore. There is no drinking, no eating, or applying cosmetics or contact lenses in contaminated areas. We usually do not store these items in contaminated areas also. It does not matter if the food or beverage is in a sealed container, if it has a lid, or is stored in a drawer or behind a closed door. It simply cannot be in the contaminated area. This includes laboratories, exam rooms, procedure rooms, and any other room that could be contaminated. Patients are different, and we're not worried with them. OSHA is worried only about the employees. Just don't have anything there at all. Take it to the break room. Recapping of contaminated needles is only done when medically necessary, when it is part of a procedure. This is very rare. In that case, you would use the one-handed scoop method, and you have a mechanical device that holds the cap, and you could put the needle in the cap without aiming it at your hands. Hand washing is included in work practices. A very important work practice is to eliminate, where feasible, hand-to-hand passing of contaminated instruments, especially sharps instruments. There is almost no situation where the person receiving the item cannot hold something underneath the sharp and tell that person to drop it. I know there are many procedures in which the provider cannot take his or her eyes off the patient while handing it off, but this is one of the procedures that causes the highest rate of sharps injuries. So avoid that if at all possible. Now we are going to talk about personal protective equipment. This includes gloves, gown, and face protection, depending on the task you are performing. Prescription eyeglasses and decorative eyeglasses are not considered personal protective equipment. You may use a full face shield or one that goes over your glasses. You may also use the goggles plus the face masks. The goggles must have side shields. You can get a specially designed one that fits over your corrective lenses. If you are using the fabric masks, you cannot punch a hole or pull it down under your chin to breathe better. In this case, you are not wearing a mask. If you are wearing gloves and take off one finger so you can feel that vein better, you are not wearing gloves. So, your personal protective equipment must be appropriate to what you are doing. The idea is that you go into the area where you're going to perform the task, you clean your hands, you put on your gloves, and while you are doing all of that, you are thinking about where that blood or body fluid may go inadvertently, and if it may go into your face, so you add the goggles and the mask or the full face shield. If it might possibly go on your clothes or your skin, you add a gown. You complete your tasks, and while you are still in the room, you remove the personal protective equipment and contain it or discard it. The gloves you pull wrong side out. You remove one, then place it in the other hand, and then that is wearing the glove, and slide it off wrong side out over the other. You want the contaminated parts to be contained inside. If the gloves become visibly soiled, then you want them in the red bags. If there is no contamination on the gloves, then you can put them in the regular trash. When in doubt, put them in the red bags. The masks get discarded in the red bag. The plastic face shield and the goggles can be decontaminated and reused. Always clean your hands after. If those gloves are visibly contaminated, clean hands in soap and water for 15 to 20 seconds. It does not have to be hot water. It could be tepid. If they are not visibly soiled, then hand sanitizer for 30 seconds will take care of it. Personal protective equipment must be provided by the employer. The employer must also maintain and replace the personal protective equipment. The personal protective equipment may or may not be your uniform. If your employer provides your uniform to you, you wear the street clothes into the practice, you change into the personal protective equipment, you wear it only when you are performing tasks, you remove it and put it in a hamper deemed for contaminated laundry. Then you wear your street clothes home. However, if you provide your uniform, you wear it into the practice, work in it, wear it home, and wash it. Then you are to wear a gown over those clothes to protect yourself from the risk of exposure to bloodborne pathogens. In addition to being appropriate to the task, personal protective equipment must be appropriate to the user. It must fit appropriately and must accommodate latex allergy. Latex allergy is not as prevalent today as it used to be. We've gone to low powder or powder-free gloves in many offices, latex-free. However, the symptoms can be just an irritation. If your hands show irritation when you remove the gloves, but when you wash your hands it goes away, then it is just an irritation. A true dermatitis can actually go beyond the area of contact and will persist for several hours. This is even after you wash your hands and are no longer in contact with the latex. You may also experience asthma and/or anaphylaxis, so we must accommodate that as well. Some people have gone into anaphylactic shock because the latex gloves were worn or carried by someone in the room. So this is a serious situation requiring employer accommodation. When it comes to other items, your common sense, you may choose to use more personal protective equipment than is required by your employer. Be sure you know what your shoes tell your patients about your practice. OSHA does not have any specific rules about foot protection. Try to avoid wearing something that would expose your foot to having something dropped on it. A chemical can even burn through clothes and even proper footwear. If you work the front desk, it may be less likely, but either way, take precautions to avoid this. Hepatitis B vaccination must be offered to every employee that is exposed to bloodborne pathogens at no cost to the employee. The employee can decline but must sign the declination form that is in the manual. If you choose to decline, understand that you can change your mind later on, and you are still employed, then you may ask for it at that time. There should be some kind of medical evaluation prior to initiating the series. It is not a physical, but it is a few questions. These may be asked by the nurse that is going to administer the immunization, but must be signed off by a person that is licensed to do so. The questions may have you ever had an immunization, And are you allergic to yeast or eggs, depending on how it's produced? This is 3 shots over a 6-month period and is administered in the arm. It is followed up 2 months later, but a blood test is called titer to test for antibodies. If the antibodies are low or the titer is negative, then we repeat the entire series, followed by another test that is still paid for by the employer. If, after 6 shots, the employee does not show immunity, then the employee should go on their own for a medical evaluation. The employer is not required to pay for the last one, but they may, and it's entirely up to them. The evaluation is actually trying to determine if that person is actually a carrier of hepatitis B. In that case, they don't produce the surface antibodies of hepatitis B that is tested for. It is also to evaluate the person for a reduced immune system, such as an autoimmune condition that would not allow the employee to develop antibodies. It does not require the employee to quit at this time. They may just choose to take extra precautions. These records are kept in a confidential manner for the duration of the employee's employment plus 30 years. Laundry. Employees may not take anything that is contaminated home to wash, nor can any employee take home any personal protective equipment. We have some options. You may do the laundry on site. There should be a sharps container in the laundry room. Once per month, the person doing the laundry would wear personal protective equipment when sorting, should run a bleach cycle once a month. That would be just bleach and no clothes to wash out the washer. OSHA does not tell you how to wash the clothes, but the CDC does make recommendations. Water at 160 degrees Fahrenheit or 125 degrees Fahrenheit with a cup of bleach. You may instead use all disposables, in which case they are just discarded. Or you may have an arrangement at a linen service, but you must inform them of the possibility of contamination. It is up to them to make the determination to decline service, treat all linens, or give you a special bag to put the contaminated items in and teach employees how to handle. Certain items must be discarded into biohazard containers, the red bag, or regulated waste. This would include gloves that were visibly contaminated, items that are absorbent, saturated, or caked. It must be saturated to the point that, upon compression, the blood or body fluid might be released, or caked to the point that the item may lose blood or body fluid by flaking off. This would also include non-absorbent items such as plastic vaginal speculums that might release the body fluid, anything that is liquid or semi-liquid or otherwise potentially infectious. You may put items in here, but you don't put sharp items in these bags because they might puncture and cause an exposure. You seal this container prior to transport. Put on gown, gloves, face protection before you tie up the bag, because you never know what could come out before you close it. Then the red bags and containers should be removed by a licensed waste hauler. Please be very cautious with your sharps. All needles go into sharps containers, and even if you didn't use them on the patient for whatever reason, be careful, and before you leave the room where sharps have been used, that they are discarded before you exit. It is unbelievable how many housekeeping personnel have been injured by needles that have been thrown into the regular trash. These people pull the bags out of the cans and walk out and get stuck or scratched by a needle. If this happens, there is no way of knowing the source patient. If I were that person that got injured, I am not going to believe that the needle that stuck me was not used on a patient. I would demand a post-exposure exam and follow-up. Housekeeping. Disinfect your work surfaces, whether you use liquid disinfectant or you have protective coverings, anytime they have been contaminated, at the end of the shift. It doesn't mean OSHA wants you to clean your countertops between patients, but you are obviously going to clean the tables and chairs where your patients have been. You want to clean where items have been placed and you have picked them up again. Use your gown, gloves, and face protection, but at minimum, use your gloves. Most disinfectants are respiratory irritants, so even a face mask would be helpful. First, clean physically to remove debris, then use an EPA-registered disinfectant that says it will kill TB. Leave it on the surface long enough that it will kill TB. Then wipe again, disposing of all the materials in the red bag. Then clean your hands after you've finished. OSHA requires that you have a written schedule of your general cleaning. A checklist is not required, but this may be the best way for you to remember to clean your area. Periodically, inspect your waste containers and clean them if they are dirty. Let's talk about the types of products that we use and how we are using them. Remember that we have to use the gown, gloves, and face protection. If we have a spill, we are going to apply absorbent and leave it long enough to absorb it, about 5 or 10 minutes. We're going to scoop up the absorbed material and place it into the red bag, or if sharps were involved, then we're going to put it in the sharps container. At that point, we can clean the area with soap and water, or you may choose to use disinfectant and clean it up with towels, then dispose of it in a red bag. Then apply disinfectant, leaving it long enough according to the time on the container to kill anything that may be there. Wipe again and discard that towel into the biohazard bag. Your personal protective equipment will go into the red bags. Then clean your hands again. Many of you use the pop-up wipes for routine disinfection. When using the pop-up wipes, be very careful that you pull up the one you're going to use. Pull it up until just a tiny bit of the next one shows. Then pull it to the side to separate it from the next one and seal that container. If there's liquid left over when you've used the last wipe, discard the liquid so it is not used again. If you mix them, even if they are the same brand, you can make the chemical become ineffective. To make sure that those wipes remain saturated, every morning turn the container upside down a couple of times to saturate those towels. Several practices have found it best to store them overnight, upside down. Then, when you get into the office in the morning, they will be saturated. Everyone should recognize this symbol. It indicates that the item to which this symbol is attached may be contaminated with bloodborne pathogens. Treat those items as if you knew they were contaminated. If you experience an exposure, clean the affected area. If it is your face, splash lots of soap and water. If it is any other area, scrub with soap and water also. You do not need to squeeze the puncture wound, or if you do not need to use a disinfectant. Immediately after, report the exposure to your employer. Whether you are exposed or supposed to report it to your supervisor or your safety coordinator. Make sure it gets documented in every great detail. After that, you have 3 options. You can decline anything after that point. You still have to report and document, but you are not required to have anything else done if you choose. This is different than hepatitis B vaccination. If you decide not to act on this immediately, then it might be too late later. You can have your blood collected and tested immediately, or preserved and tested later. The reason for having your blood collected and preserved is, in the meantime, the employer and office should make every effort to collect and test the patient's blood. And if those tests come back negative, there is no reason to have your blood tested. Those are your choices. Take a minute and think it through before it happens to you. When it happens to you, you become panicked, and that is the wrong time to make a decision. There are different types of exposure also. If there is a scratch on the top layer of the skin with no blood, you may know the person and they are at low risk for bloodborne pathogens, or you may just document it and decline to do anything else. Don't wait until it happens, and think about it early and make a decision. The employer is required to offer post-exposure follow-up immediately and free of charge, which should be kept confidential. under the supervision of a licensed healthcare provider within the state licensure laws and under the recent guidelines of the CDC. In most cases, informed consent is required for HIV testing. It is not an OSHA regulation, but there are a few cases that in the public health laws that allow employers to test the source patient without assigned consent if they already have the blood. If you have to draw the blood, then an informed consent is required. When in doubt, get the informed consent. Lots of facilities, hospitals, ambulatory surgeries, we have that incorporated into the sign-in forms, and the forms they fill out when they come in for services. Or if you are not already, and you are a ambulatory surgery center, you might consider it. In fact, you might consider doing that for any consent form for any type of procedure. And again, you can be tested. Blood collected for future testing 90 days, then no test at all. Employee is given the source patient's test results that are to be kept confidential. The ideal situation after an exposure is to test both the employee and the source patient for hepatitis B, hepatitis C, and HIV. Then provide the prophylaxis if indicated. This is where it needs to be outsourced for an infectious disease specialist. Then evaluate any illnesses that the employee may experience in the next several weeks. Counseling on how not to spread any potential infectious diseases, along with other information that the employee may need to know at that time. What should employees know about bloodborne pathogens? Have you been offered the hepatitis B vaccination? You should know that you have the right to have that done, as well as view your own records, and who has your records for you. You need to know your risk of exposure by the tasks you perform. You need to know the personal protective equipment that you need to wear to protect yourself during each procedure. You need to know what goes into the sharps containers and what goes into the red bags. How to clean up a biohazard spill, how to clean contamination, and what you should do if you experience an exposure. Let's move on to general safety, which we have summarized here. General safety includes fire prevention with a plan and fire extinguishers, electrical safety with lockout, tagout, walking and working surfaces, personal protective equipment, and indoor air quality, radiation safety, and lasers. Do not use cords if they are damaged, and don't have them where they could become a trip hazard. Do not overload your circuits and have a ground fault circuit interrupter at outlets that are near water. Be careful with your electrical cords. Don't string them out. You can have one extension cord between the outlet and the appliance, no more than that. Do not have trip hazards. Lockout tagout is a system to prevent harm from someone accidentally reactivating a piece of equipment that should be separated from a major source of energy. This could be anything like electricity, radiation, or high-pressure water. In this case, there is literally a lock that is applied, and the only person that can remove that lock and reactivate that piece of equipment would be the individual that placed that lock and has the key or code. That lock is for larger pieces of equipment, but tagout is used for smaller pieces of equipment. You do not have to have a tag that specifies that you do not use that piece of equipment. You can use a piece of paper that has a do not use with the date and initials of the person that placed it. This recognizes the only person that can remove that tag and reactivate it. The best idea is to remove the piece of equipment that does not work into an area that is less accessible. Do not repair a worn electrical cord. Either have it repaired by a professional or buy another one. OSHA does not like to see taped electrical cords. X-rays. What does OSHA want you to do to protect yourself from chemicals? If you are still using chemicals, then they have to be labeled. The label must be legible and visible. There must be an eye wash station immediately available near where these chemicals are being used. There must be a colored X-ray symbol on the door where the machine is. You must have the lead-lined personal protective equipment that must be stored hanging or flat. Do not fold the lead vest. Some X-ray machines involve the use of a shield and dosimeter or badge. It measures the amount of radiation of that employee wearing the badge is exposed to. If you are required to wear the badge, then it should be worn on the outside of your lab jacket and not taken home or left in a car. Lasers have certain hazards associated with them. There are beam hazards, which can be fire, eye damage, and skin burns, and also non-beam hazards are not a smoke plume, infections, and hazardous chemicals depending on the procedures that are being done. Protections include eliminating or covering all reflective surfaces so if the beam goes astray, it will not ricochet all over the room. There should be a caution sign on the door. Remove or cover any flammable surfaces that should be covered with a damp cloth. This is so the beam was to hit that flammable object, a fire would not be started. Wear the appropriate goggles because it is imperative to protect your eyes. You will not know you have eye damage until it is too late. If there is a smoke plume present, make sure you use the smoke evacuator and that it is working properly. Make sure that you are wearing the appropriate personal protective equipment, goggles, and mask. Emergency action plan. If you happen to notice something that would trigger an evacuation, which could be a fire, bomb threat, chemical spill, or someone going postal, please notify everyone. It should be someone's responsibility to call 911. Someone's responsibility to notify someone at the switchboard. If you are managed by a hospital, they may require you to call their switchboard. The usual emergency number is 911. Notify everyone, but don't yell fire, because that will cause a panic. Just calmly say that everyone needs to get out of the building, exit the building or suite. Those of you that work in an office or a business office, please assist your coworkers and anyone in your lobby. Those of you who work in the back areas, please assist your coworkers and anyone in your patient areas. Always exit through the nearest unobstructed exit. Don't go through the fire. Don't open the door to see if the man on the other side truly has a gun. Don't shake the box to check to see if there's really a bomb inside of it. And don't taste that suspicious powder to see if it's anthrax or ricin. You don't know. Go as quickly and safely as possible outside your building to your pre-designated meeting place, which may be the sign at the front of the parking lot or the dumpster at the side of the parking lot. Wherever it is, get away from the building. You do not want to be close because if there is an explosion, there can be flying debris. Do not block access for emergency vehicles. Stay with your safety coordinator until you are given the all-clear sign to go back in. Ladies, you have something near and dear to you and you think your life is in it, but it is not. Your purses, your handbags, whatever it may be, leave them inside. They are right next to you, unless they are right next to you. Your life is inside your body, and it is not replaceable, but all the stuff in the purse is, so get out of Dodge and be safe. There may be a situation in which you determine it would be wise to make an attempt to extinguish the fire, especially if someone's hair or clothing were on fire, or you have erupted in spontaneous human combustion. If you are smoking, we will assume you are on fire and take the appropriate measures. We first remove the extinguisher from the bracket or box, break the seal that is holding the safety pin in, and remove the safety pin. Aim the nozzle at the base of the fire, starting 8 to 10 feet back, using a sweeping motion as you approach the fire. Don't try to put it out from the top down. The flames will spread. It could possibly spread to your clothing, which would not be good. Hazardous Communication Standard. Now we're going to move on to the Hazardous Communication Standard, which requires manufacturers to determine the hazards of the products they produce, to include all the required information on their containers, and to provide safety data sheets with the initial shipments to their customers. Most of us do not get our products directly from the manufacturers, so we rely upon the distributors to provide the safety data sheets to us upon request, but most do it anyway. Employers are required to make a list of all chemicals, hazardous chemicals, and to update it every year to obtain safety data sheets for each of those chemicals, to prepare and implement a written control plan, to make sure all containers are labeled, primarily the secondary containers, and to make sure all employees are safely trained in those chemicals before they are required to use those chemicals. Be aware that the first indication that you have experienced an overdose to a chemical may be an acute symptom such as sneezing, coughing, runny nose, watery eyes, itching, irritation, rash, dizziness, lightheadedness, fainting, nausea, diarrhea, vomiting, and even death. However, some chemicals don't cause immediate side effects, and they may not cause side effects until you've been exposed over time to a larger quantity of it. These chronic symptoms are organ damage, cancer, fertility problems, genetic problems, birth defects, and even death. Manufacturers are required by law to do every bit of labeling that is required on the containers that they ship. You do not need to add anything to all those containers. However, when you transfer a chemical from the manufacturer's container to another container, that container must be labeled. Even if this chemical is not hazardous, at least the identity must be on the label. You must identify the contents, and you must be able to link it to your safety data sheet, especially if it is a hazardous one. Hazardous chemicals must also have hazardous warnings. All chemicals must be labeled with labels that are legible, that are in English, and others if necessary. And they must be where you can see them, not on the bottom or on the side, or the side that's always against the wall. They must be visible. You will soon start seeing pictograms. They are symbols with a red diamond outside them, a white background, and a black picture within them. The pictogram that indicates a health hazard is shown here on the left side of slide 41. It shows a silhouette of a human with what looks like a starfish on his chest. The symbols indicate the contents of this container may be carcinogenic, mutagenic, reproductive toxicity, respiratory sensitizer. It may be toxic to certain organs, and it may have aspiration toxicity. The one on the right is a little more self-explanatory. It is a gas cylinder that tells us that the contents is a gas under pressure. The exclamation mark has many meanings, which can be an eye irritant, skin sensitizer. It could have acute toxicity, but may not have long-term effects. It may have a narcotic effect. It may be a respiratory irritant, or it may be hazardous to the ozone layer. The next one is an exploding bomb, which is an explosive, a self-reactive, and an organic peroxide. The corrosion symbol is showing something being poured onto a hand and something else like on a countertop. This is going to cause skin corrosion or burns and be extremely harmful to the eyes and even corrosive to metals. The flame is very self-explanatory. It means that the contents inside are flammable. It may be pyrophoric. It may emit heat on its own and emit flammable gas. And it may be self-reactive or an organic peroxide. The flame over the circle, it is an oxidizer that may feed the flame. The one on the right of slide 44 is not mandatory, which just means that it can be harmful to the environment. The skull and crossbones, it is a poison. You will start seeing some signal words. Danger is if it is more severe hazard, and warning if it is less severe. Fairly soon manufacturers will be made to have on their labels a pictogram and an appropriate signal. We currently have something as you know as material safety data sheets. OSHA is in the process of changing these to safety data sheets. The purpose is to improve the information on the documents, to make it easier to find the information that you need in an emergency, and to comply with a globally harmonized system to meet international standards. They will begin to look a little bit different, and you will see them eventually. The identification will be the first thing that you see, and next will be the hazards that are composed by the chemicals, along with the composition and the first aid measures. Firefighting measures, if applicable, what to do if there is an accidental release, how to store and handle the chemical, what to do if you have an exposure, what the physical and chemical characteristics may be. They are actually trying to make these in an order that has the ones from the most pertinent information first, then less critical information toward the bottom. Some of the information, for example, ecological and disposal, is actually optional. We have some compliance dates for the new requirements. Our first date is December 1st of 2013. Employers must have trained the employees on the safety data sheets and the new pictograms. By June 1st, 2015, manufacturers must have everything in place except for the new labeling, but must be compliant with the new labels by December 1st of 2015. By June 1st of 2016, the workplace labels must be compliant. The employers must have a written HAZCOM plan to comply by the regulations and have training on the new safety data sheets, their new written plan, and the new labeling system. As far as those workplace labels must be, it is made clear that you are able to use your old labeling system for now, but at some point they will be switching over to the new label system. So stay tuned. When it comes to controlling exposures to hazardous chemicals, it is very similar to controlling exposures to bloodborne pathogens. We start with engineering controls. Good ventilation and properly functioning hoods if indicated. Then we have the personal protective equipment, gown, gloves, and face protection as listed in the container, on the container or the safety data sheet. We substitute where possible to use less hazardous chemicals. Good work practices like no eating, drinking, applying cosmetics, or applying contacts where hazardous chemicals are used. Keep the surfaces very clean and wash your hands after using the chemicals. This is the one time that you want to wash your hands instead of using a hand sanitizer, because that just might rub it in. You want to remove the chemical. Scrub all surfaces of the hand for 15 to 20 seconds. We have on this slide common chemicals that can be found in the medical and dental offices, and listed with them the hazards. Alcohol is poisonous and flammable. Antineoplastic drugs are used to treat cancer but can cause cancer. Formaldehyde, which is in formalin, is an eye irritant, a respiratory irritant, and a carcinogen. Nitrous oxide is an oxidizer and is an irritant. It can make people become irritable and drowsy. Phenol can also cause major skin burns and can be carcinogenic. That is just a few to give you an idea of the hazards associated with those chemicals. You must have a spill kit. When you have a spill, you use your absorbent, leave it on long enough to absorb the spill, sweep it up, and dispose of it according to the information located on the safety data sheets, most of which can go into the regular trash, then can be cleaned with soap and water. Depending on what chemical you are using, we advise that you use your gown, gloves, and face protection. Now, if you were cleaning up something volatile, like formalin, the gown, gloves, and face protection would be recommended because it is more irritating. Some other chemicals may be more irritating than others, so if a spill, spread absorbent, sweep up, dispose of, wash off, then spray down and wipe up with towels. Follow the manufacturer's instructions or the SDS sheets As to how to dispose of chemicals, most of the chemicals we put in the regular trash. Biohazards will still go into the regulated trash, along with mercury, antineoplastic drugs, and certain radioactive materials. Call your waste hauler if there are any questions, because they will have your answer and a lot of good information. If you get chemicals in your eye, get to an eye wash station immediately. Activate the eye wash station, hold both eyes open with your hands, and flush both eyes for 15 minutes. This may seem like a very long time, but our eyes are very sensitive, and you definitely need to get that chemical out of there. What every employee should know. They should know where the safety data sheets are located. You should know what hazardous chemicals you use and how to safe in handling them, and what kind of side effects you might expect. Know the location of your eye wash station and how to use it. Where's your spill kit and how to clean up a spill. Our next topic is on ergonomics, the purpose of which is to reduce or eliminate the musculoskeletal disorders. Types of things that you might experience are back injury, carpal tunnel syndrome, back and neck injury, or strain. We did have a standard for a short period of time, but it has been revoked. OSHA does have lots of guidelines that are very helpful. They are concentrating on ergonomic hazards in nursing homes. If you are lifting heavy materials, use good body mechanics. Use your leg muscles and not your back muscles. Keep that additional weight as close to your body as you can. Don't twist or turn. Take tiny steps and kind of pivot. If you are assisting patients from their wheelchairs to the exam tables or to dental chairs, lock the wheelchairs and get someone else to help you. If you are lifting heavy computer paper, divide it and take a couple of packages at a time, or put them in a rolling chair and roll it rather than walking a long distance with it. Just use common sense here and protect your back. There are several ways to protect yourself from getting carpal tunnel syndrome. If you are doing ultrasonic or dental procedures, try to use your whole arm instead of just your fingers and your wrists. There are some braces and splints out there that work good for this. For extended keyboarding, use an ergonomically correct keyboard and add a wrist rest. For every couple of hours, do some ergonomic stretches. Vary your duties. If you've been keyboarding for a while, get up and do some filing. Do something a little different, so get up and move around and get some water. Symptoms of carpal tunnel syndrome are pain in the area, numbness that radiates up the arm. There are some special exercises that can be done to reduce the pain or help to relieve the problem. If you are seated at a computer workstation for a long period of time, you should arrange that computer station so that your feet are on the floor or on a footrest. Your thighs and forearms are essentially parallel to the floor. Your calves and upper arms and back should be perpendicular to the floor. Your wrist and head are straight and your shoulders relaxed. You should not be scrunched, twisted, or in any awkward position. You should be in neutral position. The terminal should be positioned directly in front of you. The top of your terminal should be at eye level if you are typing from the document. It should be directly beside your terminal and not flat on your desk or over to the side of you, so you don't have to move your head or strain your eyes. You should have the window beside you and not directly in front of you or behind you, because it could cause glare. They make a filter to help with that. If the print is too small, enlarge it or get a larger screen. Let's go on to workplace violence. There is no standard, but there is a lot of guidance. OSHA has looked at this several times for healthcare workers. This is the most recent guidelines. There are 4 types of workplace violence that could happen. There's criminal intent, usually robbery, drugs, cash, expensive equipment, computers, personally identifiable information, credit card numbers, Social Security numbers. The second type is what we experience in healthcare in what would be your patients. Coworkers, current and former employees, managers, supervisors are the third type. It can be personal in the fourth type. which means it's usually a domestic situation where the significant other has come back into the practice. There are certain ways to be prepared. When you see someone acting up, try to stay as calm as you can. Keep the words you use, your tone of voice, and your body language very neutral. Let that person know that you are upset, or that they are, even if they are upset, that you're going to do everything you can to resolve the issue. If you can't, get someone else. Usually, if you get the provider, that will resolve the issue. Offer to get your supervisor or your manager. Get whoever you need, and you may need to call the police. Please try not to let it go beyond someone being unruly. You may have to tell someone that you're going to have to call the police if they do not cooperate. Please leave and come back when you can be calmer. If on the phone, tell them that you're going to have to hang up and that they will have to call back when they are calmer and you can speak to them rationally. There are times that you simply have to call the police. There are things not to do, like ignore the person or their problem. Don't make threats or promises, and don't make it worse by being confrontational. Just be careful about how you act and what you say and in what tone of voice. This usually erupts up at the front desk and is triggered by someone that had to wait too long, and it becomes an infectious process. Everyone else starts getting agitated as well. If someone starts to act up at the front desk, the best thing you can do is put them in a holding room. When the situation is resolved, then document the whole situation and be very objective. This is to protect you and your office later if you decide to dismiss the patient from your practice. Sometimes the employer may need to provide counseling if someone is having a hard time dealing with what happened, especially if there was bodily injury. There may be some aftermath of the situation that people are coping with and need professional help. Let's talk briefly about Mycobacterium tuberculosis, which is TB. It is airborne and can be spread by droplets that can be released when an infected individual coughs, laughs, sneezes, spits, or whistles. This is only going to be someone who has the active disease. People that have been exposed in the past or been treated with prophylaxis may still have the germ in their body, but they are asymptomatic, so it is latent. Symptoms of an active disease could be coughing lasting more than 3 weeks, coughing up blood, night sweats, weight loss, and fatigue or anorexia. You do not need a TB control plan unless you are performing high-risk procedures on patients that have or might have tuberculosis. The annual skin tests are not required unless you are required to do so by another agency. The CDC's most recent guidelines say that you should do an annual risk assessment and a skin test initially if you have not been done previously on all new hires. However, the CDC has no enforcement authority, and the OSHA is not enforcing it unless you are doing high-risk procedures, which would be bronchoscopy, autopsy, intubation, aerosol treatment, or suctioning on patient that you know or suspect to have TB, or if you are doing dental procedures in a hospital or correctional institute. If you have had a positive skin test, never have another skin test because it could cause sloughing of the skin. You are no longer recommended to get a chest x-ray at various intervals because we do not want to expose you unnecessarily to radiation. If you have symptoms, please go to your healthcare provider for medical evaluation. Symptoms are cough lasting more than 3 weeks, coughing up blood, night sweats, fever, weakness, weight loss, chest pain, and shortness of breath. This is the end, so thank you very much for listening and learning about OSHA.